Hey guys, I'm Siobhan, a fifth-year medical resident. Now, I'm training to become an adult rheumatologist, and part of that process is doing 1 month in pediatric rheumatology. So for the last couple of weeks, I've been seeing kids in clinic, and it is so much fun. This morning, we're going to be in a pediatric rheumatology clinic, and I'm really hoping to introduce you to a 6-year-old girl named Mona. And then in the afternoon, we are going to see any consults that come up on the ward in the hospital. So in case you aren't sure what a rheumatologist is, we specialize in treating systemic autoimmune diseases like rheumatoid arthritis or lupus. Diseases where the patient's immune system gets confused and starts attacking the patient's body. This leads to a whole range of symptoms from painful arthritis to kidney damage or even inflammation in the brain. Morning, guys.
Morning. Morning. Morning.
This is such a skilled and caring medical team, and they've been so welcoming to me. There's Dr. Batthish, a pediatric rheumatologist, Debbie, registered nurse, Maddie, a resident physical therapist, and Amy, a child life specialist. And as you'll see, they each play an important role in the treatment of these kids.
Hi Siobhan, so our next patient is Mona. She's a 6-year-old girl with a recent diagnosis of juvenile dermatomyositis.
Okay.
Mona was diagnosed in April of this year, and she's done tremendously well since starting therapy with methotrexate.
Oh, good.
So Mona's in today for her methotrexate injection and a physiotherapy assessment.
Hello, Mona. Hi. How are you, sweetie? Are you doing well today? Yeah, wonderful. What are we doing?
Juvenile dermatomyositis is a rare autoimmune disease that affects children. Dermato meaning skin, because they develop distinct skin rashes around their eyes and over their knuckles. And myositis meaning muscle inflammation, which makes these patients very weak. 8 months ago, Mona got sick. She had so much muscle inflammation that she couldn't walk, and her parents had to carry her into the hospital. A terrifying experience for them. Mona was diagnosed with juvenile dermatomyositis, and she was treated with medications to suppress her overactive immune system called prednisone and methotrexate. And as you can see, she's doing so well now. Hello!
Hi.
And what's your name?
My name is Mona.
So what was it like when you first got sick, Mona?
It was like boring because walking is kind of fun.
Yeah. So it was boring not to be able to walk.
Because like, what if we can't play hide and seek and walk?
What was it like when you were in the hospital?
Nothing. I was just a bit scared because I didn't know what it was gonna be, like the needle.
Just imagine how overwhelming it must be for a little 5-year-old to get a new diagnosis, need an injection medication, getting blood work regularly, coming to the hospital all the time. So we actually have a type of healthcare provider who help kids navigate this whole process, and they're called child life specialists. Child life specialists like Amy educate kids about their illness. They help prepare children before procedures like an injection or blood work by practicing each step on a stuffed animal. This way, they know what to expect, and it decreases some of that fear and anxiety. For Mona, that includes numbing the skin with a patch before getting the injection. I wish we used this more for adults. And then picking out a toy to distract her, and a fun Band-Aid for after. Now it's time for the real deal. So Debbie is giving Mona an injection called methotrexate. This is a medication that's given once a week to suppress the immune system and prevent it from attacking her muscles and skin. And at this point, after months of receiving the injection, Mona is a pro.
When I first started working with Mona, she had a really hard time standing, walking, as well as a lot of joint contractures, which meant in her shoulders, elbows, she wasn't able to fully extend or move her joints. She also had contractures in her hips and her knees and her ankles. So Mona's put in a lot of hard work to stretch all of those joints and get her strength back up to where it is today. Now she's not only walking and standing, but she's also climbing the stairs and working on jumping and single leg balance. So she's made huge strides since we started working together.
Beep, 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 beep.
part of physical therapy is stretching her muscles. Because when Mona first got sick, she wasn't walking or moving her joints, so they tightened up, causing contractures. So even after the inflammation had resolved, the range of movement of her joints was limited. She's done a lot of work to get to this point, and look at her now. I absolutely love how fun Maddie makes these exercises. Hello! What about now? How do you feel now?
Good.
Yeah? Do you feel all better now?
Much better than before.
Yeah. What's the biggest difference now?
The biggest difference is I walk normally. All the nurses are nice to me and they help me feel better. And they take care of me and they help me feel better. And special thanks to Maddie and Debbie. Peace, guys.
Isn't Mona amazing? You can just see how comfortable and confident and safe she feels, which I think is a huge testament to this medical team. So it's amazing to see how well Mona's doing and to hear the difference for her quality of life. But whenever I see a little kid with a disease, you have to wonder, what does it look like going forward for her?
Well, we're very fortunate that we have a lot of therapy available to us for children like Mona, and with early onset treatment, they generally do really well. And so someone like Mona, who's already shown such improvement so early, I'm really hopeful that we'll be able to maintain her state of remission and eventually even wean her off therapy.
Fantastic. So hopefully just be able to have a normal childhood and
Absolutely. She should be able to do whatever she wants, any sport, any activity in the future will be available to her.
That's fantastic.
Thank you so much, Siobhan, for a lovely morning. Really appreciate having you in clinic today. I did hear, though, that there may be a consult on the ward for a possible MIS-C case. So when you're done, why don't you meet up with Dr. Cholucci to review it?
Absolutely, no problem. I'll just finish my notes and then I'll head upstairs. I love how the hospital is full of so much color. It's so cheerful. It's honestly, I wish we did this in adult hospitals. Also, check out these cute buggies to push kids around. And there's even a little parking lot to leave them in. So this is the hospital map, and you can see it's divided into 4 colors, which is really nice for kids. And it's actually really helpful when you get lost. This is the red section, as you can see. Now I'm gonna try to find the ward this patient's on. Okay, so I haven't read this patient's chart yet, but what I know so far is that she's a 10-year-old girl who was previously completely healthy and comes in today with 4 days of fever, sounds like abdominal pain, diarrhea, a rash, and has had kind of red eyes. And the question to us today is, could this be multisystem inflammatory syndrome in children, which is a serious condition that's linked to COVID-19? MIS-C can happen to kids about 4 weeks after a COVID infection, and they usually develop a fever, rash, and swelling. We're still learning a lot about the condition, but so far we know that early diagnosis and treatment is important to prevent complications. I walk into the room and see a young girl lying in bed with her mum stroking her hair. Her mum explains that they've been so careful to avoid any COVID exposures. She does attend school, but there haven't been any recent cases in her class. The girl isn't interested in talking, but she does allow me to examine her. Both eyes are red, her stomach is mildly tender, and her hands do look puffy and red. Her lab work shows high levels of inflammation, and special tests for her heart called the troponin and proBNP show that her heart is under extra stress. Some of her infectious workup is still pending and not back yet, but so far, this is looking pretty consistent with MIS-C. So one thing that's really different in pediatrics is that you're not just treating the patient, but you're often, talking with parents and counseling them, so it feels like there's kind of multiple patients in the room to look after in a way. So at this point, we need to get a little bit more information, get some blood work to look for antibodies to show if there was a COVID exposure, and an ultrasound of the heart, because the blood work showed that the heart's under a lot of strain right now, and we want to actually see how it's pumping, if there's any other issues. And the final step is actually treating her so that she can feel better again. So we need to treat the immune system that's so ramped up right now by giving a medication called IVIG and steroids. And both of those should work pretty quickly and get her feeling better soon. I just feel badly because it seems like these parents are blaming themselves. I mean, they've been super careful. There's no known COVID exposures, but often that's what happens. We're in a global pandemic, so it's impossible to avoid it completely. I'm absolutely loving this rotation. Seriously, a highlight in my training. This medical team is so passionate and they really go above and beyond to advocate for all of their patients. And it's just so much fun to play with kids and empathize with parents. I mean, there have definitely been some days that I've come home, especially after seeing some really sad cases or sick kids, and it sort of weighs on your heart. And that's tough. But then there are other days that I come home and I wonder, why didn't I go into pediatrics? Because I'm loving this so much. And then I remember this is the way I felt after pretty much every rotation in medical school, because there's something amazing to discover in every medical specialty. So I want to say a huge thank you to the entire pediatric rheumatology team, and of course to Mona for making this video possible. And if you want to see more videos like this, then be sure to subscribe, and that way I'll see you in the next video. So, bye for now.